I would like to invite to the stage Max Fuchs for a presentation of the Trans Health Platform. And before I do so, I would like to introduce Max. Max's pronouns are they, he, and they're an LGBTQIA activist who is currently studying gender studies at the University of Gothenburg. And they focus academically on queer life and activism. The current research project revolves around same-sex, intimate partner violence in Namibia. So Max, the stage is yours.
Thanks, Theo, for the introduction. And I want to introduce Hälsoplattformen. Who are we, what do we want to do, and how can you be part of it? Hälsoplattformen, or Trans Health Platform, was founded as a membership-based community platform in the beginning of this year and officially launched in June. Born out of concerns about and first-hand experiences with trans healthcare in Sweden, we aim to build coalitions with others who agree that the current system has to change. Many trans and non-binary people experience long waiting times to access gender-affirming healthcare, discrimination by healthcare providers, bureaucratic obstacles, humiliating questionnaires, insensitive language, and invisibility of their bodies and needs. We want to change that, bringing together trans people, healthcare providers, as well as stakeholder organizations and institutions in charge. We strive to de-pathologize trans and non-binary identities and to improve healthcare. We believe in self-determination. No experts need to tell us what our gender identity is or assess if we are trans enough to access gender-affirming healthcare. Woo! Yeah. We are the experts of ourselves and capable of making our own decisions about our bodies. Our trans and non-binary identities are not a pathological condition. We do not need to be cured or corrected. We also believe trans healthcare needs to be decentralized. Trans and non-binary people should have easy access to the care they need, regardless of where they live in Sweden, as it is the case for many different types of care. We aim to shorten the waiting time for a first appointment to begin with gender-affirming healthcare from 2 years to 2 weeks. We want to make space for non-binary bodies and their needs within the healthcare system. And we want to eliminate the need for a psychiatric diagnosis to have access to hormones and surgeries. Those ambitious goals require a lot of work, and our organization is still making its first steps. That's why we need you on board. If you can identify with our vision and want to get involved in our events, members' meetings, and be part of the change our healthcare system needs, feel free to reach out to us here at the conference and to become an active member of Hälsoplattformen. Active members are part of our various working groups, such as for communication, social media, political and legal advocacy, as well as health education. We brought a list where you can sign up directly here on site. You will find it where you registered in the morning. If you don't have the capacities to become an active member, you can still be part of THP, sharing our events and posts on social media and among your networks to increase our reach and thus make THP known is also important help and doesn't even cost you a crown. Stand with the community and become a community member. We got another list for community members on site as well. As a non-profit organization, we also need support in the form of donations to make events such as this conference possible. Other organizations can become non-voting support members by paying an annual fee. In exchange, your organization will receive goodies to hand out, enters a contact network, and accesses education through workshops, conferences, and more. Within the Hälsoplattformen, the members' meetings are the place where strategies are discussed, next steps are planned, and decisions are made. The members decide about the course of the organization. We also have a board, currently consisting of 4 elected members, that execute decisions and made in the members' meetings and takes care of overall organization. Through our working groups, we share tasks and responsibilities working on our goals. A board of advisors who have precious experience, knowledge, and expertise oversees our work and helps us to stay on course and consider a variety of perspectives. But enough about us. This conference provides everyone a great overview about the discourses we are dealing with, the goals we have, and why the healthcare system needs to change to speak to trans and non-binary people. Use the conference for interesting input, fruitful discussions, to get to know us and connect with each other. We are a community, we are Hälsoplattformen. Thank you.